Welcome to the Find Your Leadership Confidence podcast with Vicki Noethling. You are about to discover impactful lessons that help you grow as an individual, grow your confidence, and find the positive and good within you, so you powerfully and authentically become the best version of yourself. Be sure you visit our website at www.findyourleadershipconfidence.com. While you're there, subscribe to us via your favorite network. Now tune in, get ready, and enjoy the journey of emerging as a leader of exception in the 21st century.
Welcome, everyone, to the Find Your Leadership Confidence podcast. I'm your host, Vicki Noethling, coming to you from Roswell, Georgia. The goal of this podcast is to bring topics and guests that will empower you to become that confident leader and take your business and your life to the next level. So today I have with me Dr. Edward Feinberg, and let me tell you about Dr. Feinberg. So Dr. Feinberg works with dentists who want to improve their crown and bridgework skills so they can deliver better treatment outcomes for their patients. Dr. Edward Feinberg is a graduate of Tufts University and practiced dentistry in Scarsdale, New York for more than 40 years. Now practicing in Arizona. I got sick of the cold, I see. He is a successor to a unique tradition of restorative dentistry. He was trained by a master and pioneer in full coverage restorative dentistry, Dr. Elliot Feinberg. Related? The techniques used by Doctors Edward and Elliot Feinberg have been documented with more than 100,000 pictures taken during the past 70 years. Dr. Feinberg is currently director of Onward, an online teaching organization for full coverage restorative dentistry. To date, he has created more than 30 online courses for the site. The site also has an extensive library of downloadable material, a weekly blog, and a forum. Dr. Feinberg is a nationally recognized lecturer, a weekly blog and forum contributor, and noted author of scientific and educational articles for dentistry publications, a textbook, The Double Tilt Precision Attachment Case for Natural Teeth and Implants, and a book of essays on dentistry, Open Wide, Essays on Challenges in Dentistry to Achieve Excellence. So we are going to talk about dentistry and why, you might ask out there, my great audience, are you talking about dentistry? Well, you know, I always talk about what's keeping you from going on camera and getting your message out. And if you don't have a great smile, you don't want to get on camera. And the way to do that is to have some awesome teeth, but maybe you didn't take care of them. So we're going to talk about saving hopeless teeth so you can get your confidence back by having a great smile again. So Dr. Feinberg, welcome to the Find Your Leadership Confidence podcast.
Thank you.
Well, it is time now for the first two easy questions that I always ask my guests. The first one is just tell everybody where you're living right now. Where do you call home?
I'm from Scottsdale, Arizona, and I'm practicing dentistry here 1 day a week and working on my teaching website and involved in the Dental Association as well.
Fantastic. So talk about your journey. You were in dentistry for a long time. What was that catalyst that said, you know, it's time for me to contribute in a different way?
Well, I practiced in New York for over 40 years, and I would say it was not my plan to leave or retire. I had things happen to me. So everyone in my family passed away. That was one thing. And at the same time, I sold my practice and to a very nice guy, but he wasn't really interested in learning anything from me. And it was uncomfortable for me to stay there. And I wanted to practice and I had to move if that was the case. And I thought, well, if I'm going to move, maybe I should really move. So that's what I did.
And move to
And it
somewhere
turned out
that
to
the
be good
sun
for me.
shines.
Yeah, it turned
Yeah,
out to be a
better,
good move.
good air there. It's hot though, but good
It
air.
is
Beautiful.
beastly hot here.
Yeah. Beautiful surrounding areas though too. Some great colors of the mountain or I don't know. I
It's a
don't know if you
great place. I
qualify
met a
for
lot of
mountains.
great people here, and I'm very
Mhm.
happy.
That's good. That's a great way to be. So why? This seems like a no-brainer question, but why is it important to save teeth rather than extract them in place um, and put in implants?
Well, implants don't work the way they say. A lot of times people are not good candidates for it, and there's a rising failure rate of implants. And in fact, if you know how to do good crown and bridge, you can save teeth that have a much better track record than implants have. Crown and bridge has been around since the beginning of modern dentistry, which would be the turn of the 20th century. Implants have only been in this country since the early 80s.
Mm-hmm.
So I've seen everything with implants. We were in on the ground floor when they first came here in the early 80s. But
Mm-hmm.
I have over 100,000 pictures of crown and bridge cases where all the teeth were prepared and handled the same way, and the cases followed for decades with X-rays. And that is a rarity in dentistry. Most
Mm-hmm.
presenters don't show follow-up because they don't have that. But I
Yeah.
have cases in the mouth that I did that are in 30 and 40 years. And that's the
Wow.
best feeling in the world because you did something great for your patient. And I was trained by a master and pioneer of full mouth reconstruction and crown and bridge dentistry. And my training is completely different from what they're teaching in the dental schools. And what I'm very upset about is that the dental schools uh, techniques and philosophy veered off the course of what came first. So a lot of dentists are having great deal of difficulty with crown and bridge, and the problems they are having, like crowns falling out and decay under their crowns, were actually solved in the 1930s. That's very sad. And
Yeah.
that's why I think it's so important for me to teach other dentists how to do good crown and bridge. And that's why I have the teaching website. And that's why I write all of the articles, because
Mm.
I don't like the direction that that's going in. And I feel very strongly that if we're going to advance as a profession, anything new that comes down the pike must be compared to the standard of what came before. Otherwise, we are not really advancing. So
Mm.
a lot of patients are very impressed with technology, but technology is only a tool. It's not an end in itself. And all that really matters is the end product, not the means by which that end product was made. So technology that conforms to basic principles that I know to be true for success is
Mm-hmm.
good technology. But there's an awful lot of technology that is not. And for very obvious reasons to me, because I can size it up immediately. But a lot of young practitioners are easy prey because they don't have the background of what came before, which is very sad. So
Yeah.
that's what I'm trying to do. I'm trying to raise the standard of dentistry for both dentists and patients because I want everyone to have the benefit of what my patients had and what my dad's patients had and what my
Yeah.
dad's teachers' patients had. Because what I'm doing goes back to the roots of dentistry. And what everyone else doing is violating the basic principles that allowed
Mm.
all of us pioneers to have so much success.
Mm-hmm. I know I have one implant that I got just 3 years ago, and it was because I had a crown fail and the decay, just as you were saying in the beginning.
Yes, a lot of teeth that dentists want to extract, I could save. It really depends on the individual circumstances.
Mm-hmm.
But when I go to the lectures, I see them extracting perfectly good teeth and putting implants in. And sometimes I see absolute invasive treatment, which I think is wrong.
Yeah.
I think if the primary way to hold on to your teeth is to save your own teeth, and
Yes.
prevention is everything. That's so
Yeah.
important.
So very true. So talk about quadrant bridge work, and
Okay,
you
all
know
right,
what it
sure.
is, and um, you know why some people don't want it, and uh, you know, to convince us why it's a good thing.
Okay, it depends on the situation.
Mm-hmm.
So if let's say there is a missing tooth and you have a space, if all
Yes.
the teeth are perfect and perfect condition and there's no periodontal bone loss, an implant is the perfect treatment for that space. Then no one will, argue with that. But that's not what you see when you go to the lectures and the presentations. What
Mm.
you see is the teeth around the space either have big crowns or fillings in them, or going to need crowns, or periodontal bone loss. And when you put an implant in that space, that does nothing for the teeth around it, and the patient's problems just continue. They're
Mm.
never solved. But if you know how to do good bridge work, you can do something good for the entire area. You can bring the forces up close to the bone, make the teeth ideal shape and form, connect them together so that they help each other out rather than each tooth having to carry the load and all the forces by itself. And usually that is the end of the problem in the entire area. I've done enough bridge work to know that that's true with the techniques that I got from my dad. And the best feeling is when you look at the x-rays 20 years later and there are very few changes. You know you did something really great for that patient because their problems are over. A lot of practitioners are very happy if they get 5 years. And to
Mm-hmm.
me, if I don't get at least 10, I think that's a failure.
Yeah. So whenever you do that, in the case where there's a missing tooth, is there always is that space filled with something, or is there always going to be a space there?
Yes, no, there's no space. You correct it. So, but nobody could tell that there's no tooth underneath because all the teeth are connected. No one could
Yes.
tell in a million years.
Mm-hmm.
So it isn't true that every space has to have an implant. But a lot of practitioners today don't have very good crown and bridge skills in their
Mm-hmm.
armamentarium, and they
Yeah.
have very good implant skills. So they're one trick ponies. Everyone gets the implant. And then they end up with a hodgepodge of treatments and their problems are never solved.
Wow.
And that's what I'm against. So no one is thinking. I've even seen professors from big institutes in dentistry who were afraid to prepare teeth and instead prescribe complex treatments with implants and veneers, which makes no sense at all. When one of the most tried and true um, restorations is the 6 unit anterior bridge or front
Yeah.
bridge of your front teeth, because the eye teeth are the strongest teeth in the arch and the cornerstones of the arch. And that is really good treatment. And then that's the
Yeah.
end of it. And it's much easier to do that and get a better looking result. Implants can be very tricky because they are feats of engineering more than they are tooth replacements. And sometimes, if they're not put in the right place, you can end up with an eyesore that cannot be fixed.
Yeah.
So that is something to consider when you're going to do implants and when you're going to do bridge work. Bridge work is much more predictable if you know how to do good crown and bridge, in my opinion.
Mm-hmm. So what are the best materials for this full coverage restorative
Well,
dentistry?
the best material ever invented for dentistry is gold. There's never been anything better because of the properties of gold and the track record that gold has. In fact, in the early days when my dad started in practice, all they had was gold and processed acrylic. And the acrylic is not so nice because it's a porous material and picks up
Mm.
stain. But those cases lasted decades, many, many, many years. Now we have composite, and you can do composite to metal as a choice. And for certain high stress patients, that might be the right choice rather than porcelain, which breaks more easily.
Mm-hmm.
But if you're going to apply porcelain, it has to be an alloy because the metal would melt, gold would melt at the temperature you need to bake the porcelain. So it has
Mm,
to be an alloy. But as long as it's an alloy of precious metals, you can use that to do really good dentistry. And the precious metals cast true, meaning that when after you cast it, you don't have to do anything to the inside of it. It fits on the die and the tooth perfectly.
mm-hmm.
And that's real science. So if you do everything step by step, then you should end up with a perfect result. And doing crown and bridge in a step by step manner identifies errors that might occur
Yeah.
before they're compounded, and you can correct it so you know you're going to have a perfect result at the end.
I know my sister-in-law, her dad had probably 3 or 4 gold teeth whenever he finally passed away in his mouth. And, so that shows that that does last a long time. But
Yes,
can you afford it?
when they did that, they probably used the same techniques that I learned from my dad. So they
Yeah.
lasted a long time, longer than anything they're going to do today with all their fancy materials. That I can
Yeah.
tell you.
Yeah. I can't tell you how many times I had a crown that cracked and I had to go back again. Nobody wants to do that twice.
Yes,
So
well,
what
that's
it
not a pleasant thing. I agree.
Yeah. Why is it important to have a variety of treatment options for the dental? We aren't the subject matter experts. When we go in there, we are at the mercy of our dentist. But,
Yes,
is
that's true. Well, one I mentioned trying to save your own teeth rather than extracting them and
yes,
pushing and doing implants. And patients should understand that if one dentist can't save teeth, maybe another one can. And they should seek a second opinion before they
yeah,
make their mind up. I don't see that so much in dentistry, although everyone accepts that for medical conditions. And really, we're no different. We have good,
yeah,
bad, and everything in between.
yep, that is true. And there's a lot of dentists out there. It's not like you can't find them.
One of the problems that I see in dentistry is that a lot of dentists become very proficient in one thing. Like they might be experts in implants, they might be experts in bonding, they might
Yeah,
be experts in orthodontics, and then, or some other specialty of dentistry. But then, because they're looking through that one lens, the answer to every problem is that.
yeah,
And so they stretch their modality beyond what it's intended for.
hmm,
So it's important to be able to look at things from an overall point of view instead of a piecemeal point of view. What's going to last the longest? What's the least invasive? What's best for each patient? Because they're all individuals.
yeah,
So there's no such thing as one size fits all. So the
yeah,
dentists who can only do implants are at a disadvantage because most of the time I think that's not the right treatment. And I
hmm,
really do believe that patients should have choices. The only time I absolutely push patients into doing implants is if they have no lower teeth, because dentistry does not know how to make a good lower denture. The muscles of the tongue and the cheek lift it up, and it's luck if it works. And almost
yeah,
nobody's comfortable with those. So the
right,
only answer for those patients is implants. And they have a choice of different cases that can be done.
mm,
One choice is to put a lot of implants in and make fixed bridge work. And that's only a good choice if there's enough bone that you could put implants in deep enough that it can support the restoration. So a
mm,
lot of people are doing things that are doomed to failure because they're engineering feats. And if you,
hmm,
let's say you were going to build a bridge across the Hudson River, and you didn't put the supports in the ground deep enough, that bridge
mm,
is going to collapse. And
mm,
there are many examples of engineering disasters where they miscalculated the forces that are going to be acting on their structure and it failed. And the
mm,
exact same thing happens in the mouth, the exact same thing. So when I give presentations, I like to show the uh, I'd like to juxtapose the engineering disasters with the
hmm.
disasters that happen in the mouth because they're the same. So
Wow.
that's a very important consideration. So in the back of the mouth, on the upper, the bone is spongy, and the sinuses, which are hollow cavities, are in the way.
Mm,
And there's on the lower, you have the nerve and there may not be very much bone above the nerve that you could put good long implants in.
Wow.
So I have a good option for patients where they could put 3 implants in the front of the mouth and make what's called a precision attachment partial denture to replace all of the missing back teeth. That
Mhm.
concept was invented in 1906, and nobody knows anything about it today. And they are
Wow.
the best cases. They work on the worst teeth, natural teeth that you ever saw and last decades.
Mm.
And the actual attachment consists of like a key and a lock, or a male and a female. It doesn't actually grip the teeth, and the way it stays in is very ingenious. The angle of how you take the removable in and out is tilted in 2 directions, and that direction is different from the pull of the muscles and gravity. So if a stress is applied to it, it can move slightly to relieve the stress, but it can't come out. And those are the best cases, and is a great choice, and minimizes the number of implants and the amount of surgery that
Yeah.
patients have to go through. Because let's be realistic, it's not just the cost, it's what you have to go through and the surgery
Yeah.
that is a major
Well,
consideration. And I
I know
try to
when
minimize that.
I know whenever I had mine, uh, the time that it took for the regrowth of the root, I guess, or whatever you want to call it, the bone, um, caused my bottom teeth to move because of that opening that I had. And so my beautiful straight bottom teeth got all messed up. I was like, oh, it's sad, but it
Well,
is
I
what
can
it
tell
is.
you from my person, because I'm not an orthodontist, but I did the aligners. Uh, I work with a husband and wife couple, and I'm working with the wife because she's a general dentist, and the
Hmm.
husband is an orthodontist. And my teeth were shifted also, and that was easy. That's what I mean by there's been tremendous advancement in certain fields of dentistry, like orthodontics and also endodontics, or root canal therapy,
Hmm.
so far superior to when I graduated from dental school. But I can't say the same about crown and bridgework. I think it's gone backwards, even with
Wow.
all the fancy technology. And some of the technology is very good, but it
Hmm.
must conform to basic principles, and that they are being systematically violated without even the dentist knowing or being aware that they are.
Wow.
That's scary.
So, how does the new book that you have shed light on the issues facing the dental profession? What are some of the chapters that you have that might help these young dentists or innovative dentists to find a better way to do things?
Well, the book is really a collection of essays on different
Hmm.
aspects of dental practice. So some are uplifting and about leadership in your office, or
Hmm.
about certain marketing things that I did that are different. Um, but also, I have a lot of scathing um, uh, articles about things I'm against in my profession. Somebody
Hmm.
has to say these things that we're on the wrong course. So
Yeah.
that's kind of what the book is about. And I think that the public might find it very interesting, even though I originally intended it for dentists. I think
Hmm.
there's a lot of really, it would be eye opening and maybe shed light on some of the problems that we have in our profession. Because I really care about my profession, and I want to
Yeah.
raise the level of dentistry that's being done. And it pains me to see some of my
Yeah.
colleagues having difficulties with problems that were actually solved in the 1930s. Think about that. That's
I
scary.
know it is. Sometimes you throw out the best things with the bathwater, as they say, throw out the babe with the bathwater, and it's like, no,
It's
no,
really
no.
it's really a lack of knowledge because no one showed them. But
Mm,
unfortunately, when they go through school, they are in a way indoctrinated. And a lot of the things that they learned are misconceptions and wrong thinking.
mm,
And that's the best way I can describe it. So I'm very vocal about it because I want people to think about what they're doing. Everything that you
hmm.
do should have a reason why.
Yeah.
And I know my techniques they could hang their hat on. So I'm trying to encourage dentists to go to the teaching website because it's all there, and
Hmm.
they can take the courses at their own rate. and they can see case after case after case with follow-up. When I
Mm-hmm.
go to the lectures, I don't see any follow-up. All they
Mm.
do is show the aesthetic result on the day of insertion. That means nothing to me. I want to know how it held up,
Yeah.
because if it looks pretty and it doesn't hold up, is that something you should be doing? I don't think so.
Yeah, for sure. So in the teaching website, what is a typical course, the length? How long would they spend in doing the coursework?
Well, each course is an hour. I don't want to make courses that are too
Mhm.
long. I think today, in today's society, everyone has a short attention span.
Yes.
Me
True.
included. I'm there
Mhm.
too. I think an hour is just about right, and
Yeah,
they can go at their own rate. And there's a quiz at the end. So once they pass the quiz, then they get credit for it. So I'm an accredited provider of continuing education, and they get credit for it. So it's a win-win.
fantastic.
Some of the courses are free. I have the philosophy courses that are free. Anybody could take them. That kind of gives the whole philosophical approach of what I'm doing.
Mm,
There
good.
are four of those courses. And then the other courses are very inexpensive. But if I come across students or anybody who's, not there yet, I have no problem with giving them a code that they could have it for free. I have no problem with that. I just want them to get the
Yeah.
material. I want them to get the information they need to do better work.
So when they find you on social media, and we'll be sharing in a few minutes the contact information for Dr. Feinberg, but whenever they find you on social media, um, if they have a question, are you quick to answer in any social media so that they can kind of pick your brain a little bit?
I'd be more happy to answer questions by email. And then I can only give generalities, because unless you
Right.
do a complete exam, you can't tell anybody specifics about their condition. Because I never
Mm-hmm.
saw the patient. I have never examined the patient. I can give generalities and general information, and I'm always happy to do that.
Perfect.
I wouldn't mind doing it on social media either, but I have had people who wanted me to give them a whole course on social media, and then I sent them to the website because that's just not feasible.
Right. Well, it is that time now for me to share my slide of contact information. So if you are intrigued and you want to know more, I'm going to be able to share that information. If you are just listening, you know that you need to go grab a pencil and paper to write this down, or a pen and paper. If you can't do that, you will find everything in my show notes on my YouTube channel, Vicki Noethling. So please subscribe, as well as my findyourleadershipconfidence.com. But we all want you to have great smiles and be able to ask those dentist questions so you find the right dentist for you. So here is the contact information for Dr. Feinberg. So the website is, as we mentioned earlier, theonwardprogram.com, theonwardprogram.com. On Facebook, he is, you can find him by his name, Edward.Feinberg1. Instagram is Ed F. Berg. LinkedIn is Edward-Feinberg. YouTube is at Ed F. Berg. And his email is ed@theonwardprogram.com. I'm going to turn it
Can I
over.
also tell can I also tell them about my book? It's on
Yes, yes.
Amazon.com, and it's
Abs
available as a print book, as an ebook, and also as an audio book.
Perfect. And what else can they find on your website?
Oh, I have a lot of information. I have a documents library that's loaded with information that can
Awesome.
be downloaded, including an entire textbook. And
Excellent.
it's primarily geared to dentists, but anybody who's interested in dentistry, I think would find it fascinating.
Maybe any of those folks out there that might be just going into dental school, maybe that's a good tool for you to have to, when you're in class, to ask some intriguing questions, or
I also have a
maybe.
lot of interviews that I've done over the years, podcasts and interviews that people could listen to.
Oh, awesome. So again, if you want to find any of that information, you can go again to the onwardprogram.com, check out his book, check out those resources, and again, visit him on YouTube to see some of those interviews, as well as check out his social media. Well, Dr. Feinberg, it's been really a great conversation. As I said, I think that a lot of us forget about taking care of our teeth. I hated whenever I was in my 40s and they says, "Oh, your crown's 30 years old. We're going to have to give you a new one." And I was like, "Oh."
Well, dentistry is not really lifetime.
Yeah.
And it really depends on changes that occur. So I have patients with dentistry in 40 years, and because the changes were minimal and gradual, they didn't have to do it over. But I have others where changes occurred, 10 to 15 years, and it really should be done over. And it can be a very tough call as to when you should step in and do it.
Yeah.
Because the changes are not happening drastically. And if I come across somebody where they happen drastically, I make them get a complete physical right away because I'm concerned there's something systemically that's really wrong.
Yeah. Sometimes I know I left one dentist because he was into the cosmetic dentistry. I
Cosmetic
can say that.
dentistry.
And it was like, "Oh, we need to do this." I was like, "No, I don't think so." I'm sorry.
Yeah, that's wrong. That makes it bad. It ruins all of our reputations with people like that. No one should ever push you into doing anything for aesthetics. It would have to come from you.
Right,
For
right.
health, that's a different reason. That's a completely different reason, but not for aesthetics. And everybody's values are different. So
Very
you can't, put your values on somebody else. They may be very happy with the way they look, and that's fine.
That's exactly right. Well, it's been great chatting with you, and I hope you have a great rest of the week. And we will be checking out your website to see some of those free courses. I'm always interested to learning more about our teeth and how we can take better care of them. So definitely. And, I have a lot of friends that could probably have insights to you. So thanks so
Thank
much for
you.
being
Yeah,
a
I think
great guest.
you're a great interviewer. Will
Oh,
you let me know when the a podcast airs?
I will. We'll talk about that in a moment, but I just want to remind everyone that life is a journey and it's up to you to enjoy the ride. This is Vicki Noethling signing off.
Thank you for tuning into the Find Your Leadership Confidence podcast with Vicki Noethling, where we share impactful lessons that help you grow as an individual, grow your confidence, and find the positive and good within you so you powerfully and authentically become the best version of yourself. Remember to visit our website at www.findyourleadershipconfidence.com and enjoy even more great episodes like this one. Again, while you're here, subscribe to us via your favorite network. We look forward to seeing you next time on the Find Your Leadership Confidence podcast.